In this video, I will discuss how does carnitine work. Carnitine works by acting as a transporter molecule. It transports fatty acids from the bloodstream into cells and then into the mitochondria. It also transports waste products out of the mitochondria, thus ensuring that metabolic waste does not accumulate. The substantial effects of carnitine stem from the fact that it acts at the cellular level. This means that all your cells can benefit from carnitine. Cellular benefits across a big number of cells translate themselves into clinically observable systemic effects. This explains the wide diversity of benefits observed through clinical studies. Carnitine's primary mechanism of action is apparently attributable to its role as a cofactor in the transformation of free long-chain fatty acids into acylcarnitines for subsequent transport into the mitochondrial matrix. By helping the cell produce more energy, the cell performs its functions better. As an example, let's now imagine that we improve the function of all the cells that make up the pancreas. What would that do? Well, it would mean the pancreas as a whole begins to function better. If the pancreas begins to function better, then you would expect to see healing in patients with diabetes. And this is exactly what clinical findings show when they look at blood work from diabetes patients. This model of treatment allows the body to help itself. Both aging and obesity reduce carnitine levels, contributing to mitochondrial aging and loss of functionality. This makes carnitine a very appealing supplement for its ability to promote mitochondrial health and fat sugar utilization before problems arise. 1 gram of L-carnitine taken orally 3 times daily over 12 weeks significantly lower fasting blood sugar in middle-aged adults with type 2 diabetes. Diabetic tissue, especially cardiac muscle, can accumulate lipids that impair function. Few people seem to realize that fatty acids are the primary fuel for the muscles, including the heart. Up to 70% of the energy produced by the muscles comes from the burning of fats. Since the heart is our hardest working muscle, it is no surprise that carnitine improves myocardial metabolism. But what would happen if we increase the amount of carnitine you absorb? What would happen if we increase the amount of carnitine to levels above what would be possible through diet alone? What would happen if we synergize carnitine with other ingredients that increase energy production? Learn more by visiting howtochangeYourOwnBatteries.com. In this video, you have learned how does carnitine work.